Hi guys, today I just wanted to come to you with a brief video on the books that I use while coding. So again, I'm just going to give you a brief. I'm going to show you each book and how I use it when I do remote medical coding. So let me show you. This first book is my ICD-10-CM, and this says the complete official code book. This is the book that I capture my ICD-10-CM diagnosis codes with. Now, of course, this is the 2019 edition, but I wanted to show you how this book can come either spiral or hardbound. Now, my hardbound is an older book that I just happen to have, but I wanted to show you that these code books can come either spiral or hardbound. Okay, so those are the diagnoses. And then for procedures, I use CPT. And I have the CPT Professional. And of course, this is the 2019 edition. So that CPT is spiral. That's for the procedures, outpatient procedures. Now, I'm frequently asked about ICD-10 PCS. If this is procedures and this is procedures, what's the difference? And the difference is with CPT, we're capturing what your physician does. With ICD-10 PCS, which is also for procedures, we're capturing reimbursement for the facility. So inpatient coders use ICD-10 PCS. Outpatient coders use CPT. However, in the physician's office, again, we'd use the CPT only. In the hospital, we'd use PCS for the facility reimbursement, but they also use CPT. They capture the CPT code to go along with the ICD-10 PCS code in the facility so that not only facility reimbursement but physician reimbursement is done inpatient. So again, inpatient will need to know CPT and PCS. But if you're an outpatient coder, you're just concerned with ICD-10-CM and CPT. And one additional code book that is used is what's called HCPCS. Now this is an older edition. I don't usually use HCPCS because remember, HCPCS codes are usually charge-master driven. And if you don't know what I mean by that, on Codemaster Coach, I do have a video talking about charge-master and what it is. But it's a list that your hospital has that includes all of these HCPCS codes in it. And it's kind of like the way I described in that video briefly was loaves of bread, and how they have barcodes on it, and how the different types of bread, sourdough, whole wheat, white bread, all have different barcodes that we scan when we go to Walmart or different grocery stores. Well, based on that barcode, this book gives you the barcodes for each supply. So HCPCS are your supply codes. So if you do any HCPCS coding or any supply coding, it would come from this. But again, I have an older edition book because I don't usually do this. But again, I just wanted to share with you the books that are used for coding. Again, PCS is for inpatient coding, CPT, inpatient coding procedures. And make sure I clarify that. Okay. And CPT is used for outpatient. And that's so that the physician, CPT you'll learn is physician coding. And then with all of it, you have to have a diagnosis to justify it. So you need an ICD-10-CM book. Okay, guys? That's it. I just want to introduce you to the books. What I'll do the balance of this week is probably take each one of these books and kind of go through them with you. I'll just do a quick 5-minute video going through each one of these books so that you understand exactly what's in it. Because if I tell you that ambulance coding is done in HCPCS, you probably just don't, well, how do you have ambulance coding done in HCPCS, or breast implants or knee replacements, the actual joints, the supply is captured in HCPCS. Dental codes are captured in HCPCS, okay? So I'm going to briefly go through each one of these books in the next couple of mornings as I'm preparing my day. Okay, guys, that's it. Thanks. I will see you in the next one.